and welcome to another episode of Let's Talk About It, where we explore common mental health topics and answer questions. I'm Dr. Whitley Lassen, and I'm so excited today to be joined by Dr. Elizabeth McMahon. Dr. McMahon is a licensed clinical psychologist. She is an expert in anxiety, and she has a private practice in San Francisco where she treats clients. She's also the author of the book, Overcoming Anxiety and Panic Interactive Guide. Welcome, Dr. McMahon.
Thank you, Whitley. Thank you for having me. I'm delighted to be here to talk about OCD. It's such an important topic.
Today, we're going to be talking about obsessive compulsive disorder, commonly called OCD. We're going to be answering questions today about what OCD is and what it feels like. If you think you may be dealing with OCD, we encourage you to seek treatment from a licensed mental health provider. So, Dr. McMahon, how would you explain OCD to someone?
Well, there are parts of the brain that get overactive in OCD and that keep sending off messages of danger, that the action you're taking is dangerous, that the thought you're having is dangerous. And so basically you get caught in a cycle with OCD of your thoughts telling you, oh no, what if this is dangerous? And as a result, you feel like I have to do this, or I have to not do that in a special way, or else something bad will happen.
What are some examples of the way that OCD can show up or how people might experience OCD?
So for example, I might be setting the table or making dinner for my family and suddenly look at a knife, have a thought or an image of stabbing my loved one, be so horrified that I would be afraid that I might act on that thought had some meaning, and I might put the knife down, I might take all the knives out of the kitchen and be afraid to touch knives. Or if I'm driving and it's a bumpy road, the thought might pop into my head, maybe I've hit somebody, and I might feel compelled, like I have to turn around and check and look. Or I might worry that I haven't cleaned sufficiently, even though I've cleaned my normal way, and worry about germs or illness. We're not talking about COVID precautions that are reasonable. We're talking about way beyond what actually makes a difference. And sometimes OCD shows up as a need to have things in some kind of perfect, rigid order, a feeling that things have to be just right or else something is terribly wrong. So OCD can show itself in a number of different ways, but it's the same underlying problem and process.
It sounds like OCD is an anxiety problem. And we talked before about the cycle of anxiety. How does OCD fit into that cycle?
I think OCD fits very well. There are two triggers that can trigger OCD and distress that I think are particularly relevant for OCD. One is genetics. Anxiety, including OCD, tends to run in families. You may simply be born with a nervous system, a brain that's more likely to develop this overactivity. And a second factor is making a demand for perfection, seeking certainty or guarantees. Both of these can make it more likely that the brain gets a message that something is wrong, something is dangerous, so that your body feels tense, anxious, nervous, scared, and your thoughts turn to what's wrong? What if something happened? And as a result, you start to take actions to try to prevent the danger, to try to be safe. You try to stop the thought and fight it or to avoid it. And unfortunately, this, what if something happens? Oh, I have to do this or else, creates a vicious cycle that feeds on itself. Because in OCD, the alarm system in the brain is stuck, you can repeat this endlessly. And giving in on the distress and the false alarm of danger, it's a lot like paying off a blackmailer. It may give you some momentary relief. The blackmailer goes away for a minute, but he always comes back, and a lot of times he wants more and more. He's never satisfied.
In the mental health world, how is OCD defined?
So OCD is considered a mental health disorder where a person has what are called obsessive thoughts and carries out what are called compulsive mental or physical actions. So let me talk about what we mean by that. By obsessive thoughts, we mean upsetting, distressing, sometimes horrifying thoughts or images or urges that come into your mind even when you don't want them, and that keep repeating and returning. These are what we call obsessive thoughts or obsessions. Now, these thoughts can cause so much distress that you feel like you have to do something to make them stop or to prevent something awful from happening. And because you feel like you have to, because you feel compelled, these responses are called compulsions. And compulsions can be physical actions like cleaning repeatedly, washing repeatedly, counting, checking, going back and repeating actions, or they can be mental actions that you just carry out inside, like reassuring yourself or counting silently or repeating words. You can feel compelled to repeat what you've done over and over, even if you've already done it several times, and even if on some level you know it doesn't make sense.
What are some common examples of obsessions and compulsions?
Well, some very common obsessions are worrying thoughts that intrude into your mind about germs, things aren't clean, worries about purity, worries about things being right, they're not being right in some way. There can be obsessive thoughts that things have to be symmetrical or perfectly ordered. They can also include personally taboo and upsetting thoughts like sexual or blasphemous thoughts, or images or thoughts of causing harm. Compulsions, the actions that people feel compelled to do because of these obsessive thoughts, some of these actions can seem to make sense and do make sense if they're done for a realistic reason and to a realistic degree. For example, cleaning after cooking makes sense. Washing your hands after you've been working in the yard makes sense. But OCD symptoms, the compulsive actions, don't realistically prevent harm, and they're done over and over and over. So some common compulsions are hand washing, maybe to the point where your skin is cracked and broken, cleaning repeatedly or in some very rigid way that's never maybe quite good enough, putting things in order, not a reasonable order, but it has to be an absolutely perfect, specific order. Checking things. You don't check that the oven's off once, you have to check repeatedly, or checking that the door is locked repeatedly. Counting is another common compulsive action. As you can see, there's quite a variety.
What is happening in our brain when we're dealing with OCD, or what does an OCD brain look like?
That is a fascinating question. And through the miracle of modern technology, we can actually watch our brain and we can see that certain areas are overactive in OCD. And you can see in this, what's called a PET scan, you can see certain areas of the brain that are more brightly lit, showing that they are more active than normal. So in other words, something's happening in the brain that is not your choice and not your fault. But parts of your brain are sending off these thoughts, almost like shooting out sparks that start fires. And some brains spark bigger, more frequent fires. And then because the thoughts are upsetting, you feel like you have to do things to stop the thoughts or reassure yourself. And that's like putting fuel on the fire.
If you're interested in learning more, our next videos, we're going to cover what is it like to live with OCD and how to cope with OCD. So be sure to subscribe to be notified of our next videos with Dr. McMahon, where we continue to talk about OCD. If you want help in dealing with OCD, visit the International OCD Foundation Find Help website or check out these books: Overcoming Unwanted Intrusive Thoughts, Stop Obsessing, and the OCD Workbook. For more resources from Dr. McMahon on anxiety disorders, visit her website. Be sure to subscribe, follow us on social media, and visit our website for more information about our Mental Health Ally certification and our CBT courses for mental health providers. Leave us comments and questions and suggestions on what you'd like to learn more about. Dr. McMahon, thank you so much for joining us today and giving us an introduction into OCD.
Dr. Lassen, thank you so much for having me. The more you know about OCD, the more empowered and knowledgeable you are to be able to make a difference. OCD can be treated.